When we come back, more of the Andrew Lawton Show on AM 980.
This is Canada's most irreverent talk show, The Andrew Lawton Show on AM 980.
We have got to take a break for halftime here. When we return in just a couple of moments, I want to talk about this case that's going on in BC that has national implications. It will be a landmark case. It's a trial before the BC Supreme Court that has been going on for 7 months with no end in sight, but the case started 7 years ago. And it has to do with access to health care, specifically choice. Whether you as a patient, as a Canadian, should have the choice to go to a private clinic and whether doctors should have the right to offer private services. It centers on a private surgery center in BC run by a man named Dr. Brian Day, who will join me in just a couple of moments. But what's interesting is that Dr. Day is saying that the government is trying to stall because the longer the case goes on, the less money he's able to spend on legal defense, whereas the government has an unlimited supply of money. So there might be some legal tricks that are being played here. We'll talk about that later on in the show. But it's a really fascinating case. And like I said, one that could fundamentally transform the way healthcare operates in Canada, simply because it's a charter challenge. That if the charter rights are deemed to be in violation by the provincial healthcare codes, who knows what's going to happen with it. That's coming up next in just a few moments here. You're listening to The Andrew Lawton Show, Canada's most irreverent talk show here on AM 980. Stay tuned.
Kicking ass and taking names along the way. This is The Andrew Lawton Show on AM 980.
When you look at this case that's going on in British Columbia about healthcare, it is one that has the potential to fundamentally transform the way the healthcare system in Canada is structured. That's why it's so important. It's about patients having the right to decide how they access care. It's also about practitioners having the right to decide how they offer it. And the case itself has revealed some very concerning trends. The government stretching this out, dragging it out because they have an unlimited war chest. Those going up against the government don't. It's about a private surgery clinic in Vancouver. It's been in operation for over 20 years. Dr. Brian Day is advocating a message that his charter rights are being denied by the government, not permitting doctors to work above and beyond what the government says is allowed. I want to welcome to the show on this Dr. Brian Day at the center of this case. Dr. Day, it's great to have you back on the show. Thanks so much for the time today.
No, thank you for having me.
So I know this has been 20 years of your life that this clinic has been operating. I know it's also been about 7 years of your life that this has been really an illegal situation here. But give a bit of a primer for people that haven't been following this. What is really at stake in this case?
Well, this is a case about the rights of Canadians. It's already been in the courts in Quebec, and then it went up to the Supreme Court of Canada, and that court ruled that the civil rights of Canadians was being violated in Quebec because the government under the health system promises health care and then fails to deliver it in a timely manner, and then outlaws a citizen's right to look after their own body. And I'm not actually a plaintiff. The plaintiffs in this case where our clinic is a plaintiff, but there were 6 patients, 2 of whom have died of cancer during the wait to get to trial. Of the remaining 4, 3 are children, 1 paralyzed for life, after waiting 27 months as a 14-year-old to get into hospital for spine surgery. And this wouldn't happen in any other developed country on earth. Both the federal minister and our BC minister have acknowledged, based on a Commonwealth fund that came out recently, that Canada's health system is not performing as well as countries in Europe that have hybrid systems, and thereby a little bit of competition for the public system. So what we're fighting for is to give Canadians outside of Quebec the same rights that the Supreme Court of Canada granted Canadians living in Quebec, and also the same rights that exist in every other country on earth. I mean, when we think of Sweden and Norway and Denmark and Holland, these are not right-wing countries without concerns for social programs. These are countries that are concerned about healthcare and education and looking after the lower socioeconomic groups in society. They all have recognized the need for some competition for the government monopoly. That's what we're fighting.
One of the lines that sticks out is from the Supreme Court case in 2005, where the court ruled, quote, access to a waiting list is not access to health care, unquote. And that sums up so perfectly the problem that a lot of Canadians are facing on a very regular basis with health care.
Yeah, and the problem is, that at any one time, until you need it, the health system seems fine, because you've given this perception that it's free at the source. Well, it isn't free at the source. 70% of the public have extended health. Well, it's really a word for private health, which covers prescription drugs and ambulance services and things that are absolutely necessary, but 30% of the public don't have access to. So one of the things that we will have pointed out at the trial is that in Canada, the worst outcomes in health and the worst access are in the lower socioeconomic groups. That's not what it was supposed to be. And so what we have, the other thing that the Supreme Court of Canada said in the Quebec case was that patients are suffering and dying on wait lists. And that is something that governments have to take to heart, that literally, and this is not from me, this is the Supreme Court of Canada saying that the system is killing patients in Canada, and we know that it is.
So when we look at your clinic, what is the actual sticking point here? I mean, what is it that you're doing that is so contentious?
Well, what we do is we allow BC patients on wait lists who are waiting for access in the public system the same privileges that the law allows for non-BC patients and for BC patients who are covered by workers' comp or are members of the RCMP or the Canadian Armed Forces or prisoners. I mean, federal prisoners are exempt from these laws. And basically what we're saying is we should not be the only country on earth that states that it's unlawful to buy private health insurance. We have patients waiting a year or two for joint replacement surgery that are limping around in pain, taking narcotics sometimes, that are becoming addicted to narcotics. And our provincial health minister is a vet. If you treated if he treated one of his patients like that, he would be charged with malpractice. That it is unacceptable to keep an animal in pain for a year or two, but it seems to be the standard here. And as I said, the problem is until you need it or your family needs it, you don't really get it, and that's part of the message we're trying to put across. But we've been met with a barrier at the courts. That the Quebec case took under 4 months. We've been going for almost 8 months now, and no end is in sight. The government, for example, we have the government trying to block evidence at every stage. We've had government documents produced by the ministry or by the government, by statements from the Minister of Health, official statements. We are trying to get those put into the court, and the government saying is arguing that they're not admissible. And I include things like an official apology to the mother of the young boy who was paralyzed. They're saying that's not admissible because they don't accept it as fact. And it's their own document. So that's what we're facing, and they're using every trick in the book to delay and block us, and it's all in the hope of making us run out of funding. That's what I'm convinced. I'm convinced it's all, and we're a small clinic. We don't make, in the last year there were 70 clinics in BC doing some kind of private work. 10 of them have closed in the last year. About the third biggest went bankrupt last week, or 2 weeks ago. And so we are now. We've had to take a break to try and recharge our kiddies, because it's very expensive to take on government that has your money to fight you with.
It's the ultimate David and Goliath situation I'm hearing. The government has no cap. You, at a certain point, have to look at the bank account and say, look, this legal fund is at zero.
Yeah. And we are, there's a group called the Canadian Constitution Foundation that is helping us in that regard. They're a national charitable organization who take on constitutional issues that are where the government is basically obstructing the rights of citizens. You know, there's a person called Ayn Rand who said, you know, the role of governments is to protect the people from criminals. The role of the Constitution is to protect the people from governments, and that's really where we're at with this case.
When you look at the actual vision, I mean, what is the end goal for you after this case? What would you like to see the healthcare system in Canada look like?
We'd like to see it look like Germany or France or Sweden or Switzerland, where everyone, rich and poor alike, have quick access to healthcare when they need it. And that is achieved by having a hybrid health system where there's a little bit of competition for the government system. When you have this, you know, our opponents will say, oh, well, this is about rich people getting access. This is not. As I said, it's the poor and underprivileged in Canada who have the worst access. And no one should believe that the rich ever have a problem because they just go down to the United States. So what we want is a health system that's on a par with that in Switzerland and Germany. Now, in Germany, they have no wait lists in the public system. About 10% of their system is private. But you don't wait in the public system. You might get a nicer room in the private system, or you might get wine with your dinner. But in terms of healthcare, you get excellent healthcare access. That's what we want here. To have children waiting 27 months and ending up paralyzed, that's not defensible, and that's why the government doesn't want to defend this on the evidence. They want this case to go away, and it's being driven by a bureaucracy. In Germany, there is one public health bureaucrat for every 11 that Canada has on a per capita basis. We have 11 times as many public health bureaucrats, and that's where the money is going. We're wasting money in Canada. We have 14 ministries of health for a population of 35 million. Germany has one minister of health for a population of over 80 million. That's where the money's going.
I realize government wants to hold on to its monopoly here, and that is what's driving the way they're behaving in this case and whenever healthcare has been raised in other capacities here. But it's really counterintuitive because you're offering an avenue and you're advocating for an avenue through which patients who are on wait lists can get healthcare. And the irony is that government says it's the best at delivering healthcare, but they're trying their darndest to block something that would actually allow people to get it more promptly.
Well, yes, and you know what's interesting? I mean, this even applies to some of the lawyers arguing against us. You know, one of the analogies we use is education. I think it's arguable, and actually, our Minister of Finance argued in the recent provincial budget, the most important service a society can give, a government can offer to society, is education, and education, of course, is a key to health. No one would suggest outlawing the right of an individual to send their children, if they so choose, to a private school, as long as everyone, which they do, continues to contribute to the public system. And that's basically what we're arguing. That why should we have any different approach to healthcare? They're both vital services that we all believe in a strong public system, but it's not in the recent Commonwealth Fund, which is a non-profit association that actually advocates for poor and underprivileged. They rated 11 health systems in the richer countries, developed countries. Canada came ranked 10th overall in efficiency and quality. The United States was ranked 11th. Our opponents keep trying to say, oh, we want an American system. Well, that's ludicrous. We want a system like the top-ranked systems in the world from akin to the social democracies that exist in Europe.
Yeah, and that false dichotomy of it's either a Canadian system or an American system always frustrates me because neither is a particularly efficient or cost-effective one.
Well, the U.S. system is on a value for dollar basis is the worst in the world. Now, at its best, of course, it's excellent, and that's why a lot of our politicians go down there if they can afford it. But that's the point. Is this is a diversion away from reality. Mm-hmm. What we want is a universal health system that is good for everyone, that has a little bit of competition, that improves, that empowers the consumer. When there is no competition, when you have I don't know of a single monopoly that empowers the consumer, and that's what the government has, and they're determined to hold on to it, and we're determined to not let them hold on to it.
I know people can contribute to this constitutional challenge online. The website, yourhealthcan'twait.ca, www.yourhealthcan'twait.ca. Joining me on the line is Dr. Brian Day. Dr. Day, always a pleasure. Thank you so much for coming on the show.
Thank you, Andrew.
All right, all the best to you, sir. We've got to take a break here. When we come back, is what he is advocating for that unreasonable? Choice for patients, choice to go to a private clinic when he's able to function. The mechanism is there. But the problem is the average patient on a wait list can't go to see him. Only some can. And he's saying, why don't we allow everyone to? This is not rocket science, folks. This is healthcare. Here we have a guy who's actually trying to offer it. If you have to pay a little bit out of pocket, fine. But currently, the government's not making good on their end of the bargain to provide it in the first place. 519-643-2222 is the number, or 1-866-354-8255. This is the Andrew Lawton Show on AM 980. The great thing about the David and Goliath comparison is that David ends up winning that one. And also everything in Israel is named after David now. They just love David. And they should. He's the guy that conquered the beast, the behemoth, the thing that no one else could do. And here we have in healthcare, the little engine that could, Dr. Brian Day running a small clinic in BC, the Cambie Surgical Center. And he's advocating for the right to operate on the private market, which he already is. But the problem is not all patients have access to it, not because of the cost. Not all patients have access to it because of the law. And what has been determined legal in Quebec in a trial that lasted less than 4 months and went up to the Supreme Court to the BC Supreme Court is taking 7 years. The trial has been going on for 7 months. The case itself has been going on for 7 years. Almost half the time that the actual clinic has been in operation. This began in September. It was supposed to go 24 weeks. There have now been 80 days of proceedings. And the government, in court rather, has been dragging it on. Dragging it, because they know that they can just keep going back to the taxpayers and it takes as long as it takes. For Brian Day and the Canadian Constitution Foundation, which have to actually fundraise the money or pay out of pocket for these guys, they need to take a break now so they can actually replenish their legal defense fund. This is why it's important for people to contribute. Yourhealthcan'twait.ca. What better name for a domain? 519-643-2222 is the number, or 1-866-354-8255. We'll go to James on this one. Hi, James.
Hi, good afternoon. Happy Easter.
You too.
Andrew. I was talking to a young lady a couple of years ago from Cuba and spoke better English than I do. And I was asking her, is it true that everybody gets, like the good doctor was just talking about education and healthcare? She says, yes, everybody gets that. It's not just a certain class of people that get education. But, yeah, maybe we should have a healthcare system. Well, for sure, like Sweden, some of these countries, Andrew. But Cuba wouldn't be. I'm sick and tired of people comparing us to the States because it should be like a sports team. We should be number one or number two, not right beside the U.S., you know. But I agree with everything the doctor said. It just makes me so mad. all this crap going on. It's funny how in Quebec anything goes, and good for them in a way.
Well, because every time Quebec has found themselves butting heads with the Constitution, they just stick their middle finger up and say, we're going to do our own thing.
I'm so sick of the, just a couple of years ago, right, Craig, they protested the tuition fees. So they went down. How come, and then now with the, like you just said about their healthcare system, I couldn't agree more with the doctor, though, what basically he's saying. But, yeah, it wouldn't hurt for us to have a... But then, speaking of, he said about competition, we've got Rogers, we've got these different... but still the prices are really high, especially with Rogers. It's just nuts. So
but again, there's another problem where a lot of these telecom companies have de facto oligopolies because of the government. The best thing government can do for consumers is to let there be competition.
Like with the taxi cab companies, Andrew, the prices are all the same. Now, you might get a slight break from one of the cab drivers, but generally speaking, why is it they all charge the same?
Because government makes them do it, and this is precisely the problem. Whenever government is involved here, competition is not allowed. We need government to back the heck away